training programs, people will be using the robot when they're coming out of residencies, and so they will have training in that group now that wasn't given years ago. For the new surgeon in the community who is adopting robotic surgery, there's a set program that they have, and you do some online things. But then they have a simulator that's a robotic console that you sit at, and you can operate on a simulator, which is, even in my time when I started, has become more advanced because it's almost like you're doing a real operation now. It's before it was more of almost like a video game where you move things around but the computer keeps score and will tell you how well you're doing. So you can improve your skill, and you spend 8 hours or more doing these simulators, and they typically don't let you advance until you've proven your score. So that gives you hand-eye coordination and gives you an idea, really. So you become second nature to using your fingers instead of hands and things to operate. You already have to have the knowledge of the anatomy and the skills and things, but then after that you go to a case ops. Like I mentioned, there are case ops, so you go and see a surgeon doing 3 or more cases to get the idea of how this can be incorporated into your day. A lot of surgeons worry about, well, this will take too long, and I have to do so many cases a day. Well, we can show you, like in a case ops setting or epicenter setting in particular, where we can do cases very rapidly for the operative team and turnover. Then after that's completed, you go to what they call a tissue lab, and that's either a cadaver surgery or a pig surgery, and so you're using real tissue. And after that, you'll go back to your institution, and then you have a number of what's called proctored cases, where a surgeon who is robotically experienced will come in and watch you use the robot and critique you and say, are you ready to be let loose? And typically it works very well. Every institution has different requirements, but those are the basic steps. There'll be different numbers for the number of proctored cases at different places, and again, different training depending on is it a GYN surgeon or general surgery or colorectal.